Hi, everyone. I'm Dr. Diana Bitner with True Women's Health.
And I'm Dr. Celia Egan, the internist at True Women's Health.
We're excited to talk about travel. As I was waiting to go live, I was looking at the woman in our flyer. And, isn't that how we all want to look? Like confident, excited, um,
Ready
wearing
to
white,
go?
right? With a hat on, wearing white. We
Yeah.
don't want to be suffering from a bladder infection, vaginal bleeding, puking with GI stuff. We want to be confident, energetic, and enjoying our time, right?
Yeah. I mean, you and I both love to travel, right? We both think it's super important for a fun life, but it can be such a bummer when it doesn't go well for a variety of different reasons.
Exactly. And even I was on call for our group the weekend after spring break, and oh my goodness, so many of you all called in because you caught things on the plane or, at the hotel or COVID and whatever. So we just really want you all to be prepared for travel. These are a lot of the questions that we get in the office every day. So we just want to provide you some tips and tricks. Please feel free to ask questions, give us a comment. We've had lots of questions already before we went live, so we're looking forward to answering them.
All right. So, kind of when we get started, we kind of start thinking about what we should pack. And if we were kind of there with you as you're sort of packing in your bedroom, these are some of the things we want you to remember.
So, you want to get started?
Yeah. So, I mean, some of the things we talk about, of course, you want to think about different medications, and we'll kind of dive deep per topic as to what that would look like. But in addition, we're thinking about just sort of staying clean, and we think about packing maybe extra wipes and extra underwear just in case we need it. As our body ages and our pelvic floor changes, sometimes continence can become an issue. It's an issue for a lot of women. It's not something to be ashamed about, but it's always good to be prepared to have maybe an extra pair of underwear and some extra wipes just in case.
Exactly. And so many women say they have a hard time having a BM in public places or on the plane or any of that. And so, one of the things about getting a bladder infection or bacterial vaginosis is this: if there's extra bacteria down there, it can get into the vagina and cause a discharge into the bladder, cause an infection. And so, again, just having that change of unders and those wipes handy it's a good idea. And not something I ever would have thought of before I really that more, active in women's health.
So if we're going to think about, our undercarriage, we also want to think about kind of our hands and eating. I mean, hand sanitizer is huge. So, what is the big deal of what we're talking about? Viruses and bacteria live on surfaces. And in particular, when we're in really busy places like airports where there's, thousands to tens of thousands of people walking through a day, just touching doorknobs and handles really leave bacteria sort of on our hands. And then, if we go from walking around a busy airport to eating and we're not really thinking, you then move whatever virus or bacteria are on your hands into your mouth. And that's really where they can cause some problems. So as much as you can, thinking about having 2 or 3 extra bottles of small hand sanitizer just to sort of wipe your hands down to make sure that you sort of aren't carrying on other viruses or bacteria.
And two, we touch our face so much. So it's really important to be cognizant about not touching your face when you're traveling. And even I really try, even when you're coming out of the bathroom, like to use either your elbow or just don't be touching the handle. I mean, a lot of these things we all know, right? We're preaching to the choir, but just to be really cognizant, the elevator buttons, the railing, all of that, to be really cognizant to then, like you say, hand sanitizer, not touch the face, and just be really cognizant. Even that little bit can make a difference.
And to swing from not fun things to super fun things, what would you say is one of the other things most women should remember to pack?
Where are you going with this?
Oh, all of our fun sex toys that we have.
I thought so.
Right?
So that's right. And then also some lube and all that. But, so many women talk about low sex drive, and part of it is being home in the normal work, kids, life, busy, tired, distracted. And so hopefully when you're off on vacation, depending on if it's a trip with girlfriends or if it's a trip with your partner, versus a family trip and the kids are in the hotel bed with you. But if you're off, with your partner and sex is going to be on the menu, it's then thinking about, okay, I'm going to maybe have some time and some toys for extra exploration.
Because I just want to remind everyone, because this is one of my favorite facts that I've learned with working with you, that only 30% of women have an orgasm without clitoral stimulation. So that means 70% of us, right, need that extra clitoral stimulation. And what a bummer to be on vacation and not have that happen.
That's
So,
right. Lucky 30.
yep, reminder that if you're in that group of the 70, not to be ashamed, pack that sex toy and kind of get ready to go.
And, it's interesting, I guess, just on that, to maybe go off on a little tangent. I've seen a lot of women lately who were raised in the chastity culture, where it was not okay to have sex before marriage. And then once you're married, it's like, oh, like no one talked about this. I don't know what's going on, how to have pleasure. Is it okay to ask for what I need or what I want? Or do I even know what I need or what I want? And so, part of that is maybe, I talked to a woman recently and she wasn't comfortable using the vibrator on her own at all to even explore, but with her husband, that felt okay. So again, being on vacation away from your same bedroom, kids down the hall, it might be a time to explore.
Yeah. I was actually in a hotel where they actually had a vibrator available as part of like the mini bar, which was kind of fun and exciting.
Oh my.
I know. Well, your message is getting out there, Dr. B.
That's awesome. Like, be prepared. Have fun. Right.
So, and we're going to start talking a little bit about more, medical heavy things. One thing that you have to pack is your normal day-to-day medications. I will talk a little bit about the weight loss drugs. So some of our patients are on medications that are what we call the injectables. And a lot of the times they have to be refrigerated. And these are medicines like Wegovy or Zepbound, Manjaro. They come in nice little pens. It can feel really fearful that if you're going to leave your home and leaving your fridge space, that you don't know what you're going to do. Believe it or not, it's actually okay to have the pens at room temperature for 30 days. So if you have to move it from your fridge to your purse, to the airport, moving around, it's going to be okay. Nothing is going to happen to it. It's definitely not going to become dangerous in any way. You want to try to avoid extreme temperatures. So if you're going to a really hot climate or for some reason a really cold climate and your purse would be in the car, you can on Amazon get little like pill containers where you can basically put a freezer pack kind of in a temperature controlled container and pop 1 or 2 pens in there. And that is, free to go on to the airplane that you can carry on. And it's kind of exciting and fun that that's available. People have been traveling with injectable medications for a long time in the form of insulin that needs to be cooled. So this is something that's not uncommon. And a lot of people I know, a lot of women I talk to are fearful of taking this on an airplane. And it is not something that we've gotten any pushback. I have not had one patient tell me that their drugs were taken away by TSA or anything like that. So that is not anything that I'd be worried about.
Good. I agree. And, again, that's for our patients. That's what we're here for. If you're in a city far away and you forgot your meds, we're used to getting calls of, hey, I'm in Florida and I forgot my hormone patch. Can you call out another box? So happy to do that. But again, I think it's so important, just like you're going to pack, hopefully your bathing suit and all your fun stuff, make a list, pack your meds, take them with you, and, have them labeled. You might have some ointment for your lichen sclerosis, and you might have a Good Clean Love. We'll talk about that for vaginal health. You might have your stuff. It's just to have a bag where you have all that together. Estrogen patches are pretty easy to pack. They're not going to get hurt by extreme temperatures or any of that, but it's just to make sure they're all nice and together. And so you've got those ready to go in a travel pack.
Can I ask a quick question, Dr. B? Because I feel like this is a question I get asked a lot, which is, can I wear my estrogen patch like in the ocean?
Yeah. I mean, generally for most people, if you stick it to clean, dry skin, it's pretty well stuck. I mean, there are occasional, people with maybe really oily skin that they just don't stick well. Some people have a reaction to the adhesive. That's really rare. The most important thing is to have that patch clean, dry skin, meaning you don't put it on even in the bathroom after a shower because your skin is still dewy. There's still moisture. So it's to make sure it's really dry. You don't put lotion there. It does not stick to Dove body wash or any of the moisturizing body washes. So wherever you're going to put the patch, make sure that's just clean, clean, dry, dry, dry. Maybe you put it on an hour later, or you go get your coffee and come back and put on your patch.
So what I'm hearing is if I was going to wear a patch, that it'd be okay once I put it on, clean, dry skin, to wear it in water, in a pool, in an ocean, as well as maybe going to a warmer climate where I'd be a little sweaty, as long as initially it was put on clean, dry skin.
Correct. Because it just becomes so densely adherent that there's not usually an issue. But it never hurts to take a couple extra. We've had patients call and ask for an extra box or an early refill so they can have a couple extra with them. Because again, you don't want to be on your trip and be stuck with night sweats.
Yeah. Another one that comes up a lot is like just a reminder to check on your any controlled substances. You know, a lot of times legally we can't give more than 30 pills at a time, but we can usually get a week early or so if someone is traveling. Of course, we can't do that all the time, but usually count out your pills just to make sure if you need Ambien to sleep or if you're on ADHD medication that you have enough to sort of carry you through your trip.
Exactly. And again, if you're going to be away for longer, it's in the US and there's a big box pharmacy near you. We can generally call out a refill if it's a big box pharmacy, even if we don't have a license in that state. But again, to be prepared is a lot easier than having to find a pharmacy.
Yeah. Okay. One of our next topics that we wanted to sort of talk about was vaccines and traveling to different countries and the need for maybe extra vaccines than what we typically get in our adult vaccine protocol. Hello to Deb. Thank you, from Arizona.
Hi, Deb.
When I'm in Arizona, I feel like I'm in a different country.
Yeah, exactly.
Completely different. So some of the big things that, just to get started, which is a lot of overlap with what we see in the United States, are the hepatitis vaccines. So there's a group of group of viruses that affect our liver: hepatitis A, hepatitis B, hepatitis C. There's some other ones that are a little less common, but not so much involved with travel. They're all spread in different ways, but there are vaccines for hepatitis A and B. Thank you to Laura too. Oh my God. Guatemala. Wow.
Wow. Awesome. Look forward to seeing you when you're back in Michigan.
Hepatitis A is transmitted fecal orally, which means that you somehow get some bacteria on your hands from touching kind of a yucky surface. And then again, right, you just kind of get it when you're eating, or it's maybe on your food from food prep. It causes a lot of diarrhea and it makes you feel very uncomfortable. And there is a vaccine that's available, and that's highly recommended to anyone, honestly, who is kind of an adventurous eater, even within the United States, but definitely anywhere outside of the United States, that's recommended. Hepatitis B is a body fluid transmitted virus that just basically causes liver inflammation, and down the road can cause cirrhosis and liver cancer. So obviously it's something that we don't want. The CDC most recently changed their recommendations to expand hepatitis B vaccines to all adults. It can feel funny if you're an adult who's doesn't have what we would call high-risk behavior, meaning you don't share needles, you don't have a lot of sexual partners. You're not like Dr. B and I, where we were in a hospital at some point, so possibly getting body fluids splashed in our face. So, if you're not one of those people, it might feel kind of odd to get a hepatitis B vaccine. But if you're planning on going to a third world country, we just can't say that you're not going to get into a car accident or flip a Jeep on safari or get ill, where you would need really extensive hospital care. And from there, we just don't know kind of what you'd be exposed to. So if you're going to like a third world country, we really would recommend getting hepatitis B. Hepatitis B is a 3-shot vaccine series. And then in theory, that's done for the rest of your life. Other thoughts about vaccines? I can go on a little bit more, Dr. B.
No, I'm following along. It's been a while since I've had to think about hepatitis B. I haven't been in the hospital for a little bit, but yeah, so important. And, back in the day when hepatitis, wasn't as treatable, I remember having patients and colleagues with hepatitis B, and it's a big deal. So if it's taking a vaccine, it's much better than the treatment for hepatitis B.
Then, there's a whole other collection of vaccines that are really best looked at country by country, because there's different infectious disease patterns in different parts of the world. And you really want to go to the CDC or cdc.gov. And there they have a whole travel health section where you can pull up your country of that you're going to and get a good look of all their recommendations. And that's really updated almost daily, because sometimes that's how infectious disease changes, almost like on a week by week basis, as to what is sort of being exposed in that area. Some common ones that people ask us about are yellow fever, typhoid, which are different types of bacteria and viruses that can sort of infect our body and overall cause a whole total body reactions with fevers and not feeling well, and in some cases death. It's very rare that those things happen in this day and age, but it's still definitely possible.
And so let's say a person, we've had people recently needing these, the health department, as I understand it, we're able to send them to the health department and make a recommendation, or how does someone do that?
Yeah. So usually I would sort of educate yourself on kind of where you're going. One of the big questions is if whether or not you're going to be in rural areas. A lot of these things are sort of transmitted by insects at times. And so if you're going to an area where you're not, there's a big difference between a city and a rural area where you maybe will be sleeping in a tent or going on hikes, and you'll just sort of be exposed to more things. So one, I'd educate myself about what is in the country that you will be, or countries that you'll be visiting. And then from there, we can have a good conversation about what vaccines sort of make sense for you. Once we come up with that plan, we can send you to the health department with sort of your list. You do need a good chunk of time before doing this so that the vaccines are effective. I would, as soon as I made my plans and sort of bought my plane tickets and knew that I was going, would sort of get on this right away to sort of look at what vaccines would be needed.
So super important. I think that's great. Laura, I don't know if you had to do anything in Guatemala. I don't know. I've not been, and interested to hear about your experience.
Yeah.
What about altitude sickness? We recently had a patient go to Machu Picchu, and so that was a big deal. And I know that because of how you prepared her, she was able to do well with it.
Yeah. Yes. So altitude sickness basically is when you go up high to a different altitude, the oxygen in the air becomes much less. And your body does not like that. So in response to that, of keeping the oxygen levels stable in your blood, you breathe a little bit faster. When that happens, we actually over-breathe out our carbon dioxide. It seems kind of funny to think about that being a problem, but we need carbon dioxide in our blood, and it's actually tightly regulated between our lungs, brain, and kidney to make sure that our blood stays in the right acid base concentration. So as we breathe faster and we breathe out all that carbon dioxide, sort of bad things happen. People can get really sick. Majority of the cases, people just feel ill, nausea, vomiting, don't feel well. But in the most extreme cases, people can get what we call cerebral edema, where their brain cells expand and swell. As one can imagine, that is not good. And people have actually died from altitude sickness. The good news is that if you're going to a higher altitude, you actually can take some medication to help prevent all of this, the major symptoms and some of the milder symptoms. And what that medication does is called acetazolamide or Diamox. It basically works at the kidney to help correct some of that carbon dioxide. And you should take it a few days before you start traveling to a few days after, until you're sort of back breathing in normal patterns.
Right. And I remember she said that people on the trip who didn't take the medicine were much more affected with headaches and nausea and vomiting. And again, it's a trip you might have planned for forever, and then you get there and you're sick. So we just really want to help you enjoy the trips that you're looking forward to. And Laura, you've made such a good point that your son ended up in a hospital and they asked about the vaccines and you didn't have that with you. So that's a really good point, that we should have the list of vaccines. For example, at the office, we could print off that list for you right from your chart. It's right there and available. You could just print it off and you can take it. So if anybody needs that, let us know. But if you're not a patient of ours, make sure you get that from your doctor.
Yeah. And just to circle back, I sort of forgot to mention another vaccine. One other vaccine that is really important to have up to date would be your tetanus shot. Tetanus is a bacteria that lives in dirt. And the most serious complication of getting tetanus is a disease called lockjaw, which basically all of your muscles contract and you're really not able to breathe. And people die from lockjaw. My husband actually has seen people die from it in a third world country. So it's something still today in this sort of modern era that can happen. Tetanus is not as much something that we have in our dirt, but is very common in other parts of the world. And another topic to talk about would be malaria prophylaxis. This is much more common when people are going to Africa and other tropical climates. Malaria is a mosquito-borne disease that people, again, can die from, and is a really serious problem in some of these affected areas. If you're going to an area where you'll be in rural space, you want to make sure that we get you a malaria prophylactic medication. It's a once a day Malarone, it's called, that you take 2 days before and then a week after your trip. So we got to know the days that you're going, or at least the days that you'll be in those rural areas. And that is really an important thing to have. One of the odd side effects of those drugs, sometimes people talk about really crazy dreams. And sometimes it's not as exciting. People really don't love taking it, but it truly is important because malaria is definitely something that you can get quite ill from.
Yeah. And again, would not want it. And, again, you save up for a trip like that, or you're so excited, and then heaven forbid. So again, just be prepared.
Yeah. All right. So we're going to dive into some other sort of special topics to talk about. So our sort of first topic was sort of GI issues, kind of both ends of the spectrum, so to speak.
So, again, I think it's all about being prepared, and even thinking about traveling perhaps to Mexico, where we worry about traveler's diarrhea. I just think about what I was told and has worked for me is, taking Pepto-Bismol every morning. Like, those bacteria do not like the bismuth. So being prepared to take that in advance. And then, Celia, what do you recommend to take in case someone gets traveler's diarrhea?
Yeah, we usually give patients a course of ciprofloxacin to take in case they do get traveler's diarrhea. Some of the newer infectious disease recommendations talks about sort of riding that out, but it's still good to have because they believe that traveler's diarrhea may be self-limiting, but it's always good to have that on hand just in case, you truly are not feeling well and don't have any other options if you're in a really rural location. We think of our tummies can get a little upset just from travel, trying new foods, different microbiome, maybe we're not drinking enough water. So the main difference between kind of an upset tummy and traveler's diarrhea is usually traveler's diarrhea is water. You have to think about it as your GI tract is like, get this out, right? And really, truly would be just pure water coming out of you, which sounds great, versus maybe looser bowel movements and a little cramping. That's usually more just kind of tummy upset versus that kind of pure watery diarrhea.
Right. But too, I think about, the research on the gut biome is still so new. But a recent podcast I listened to was just fascinating about how, when we travel, we're eating different food, we're exposed to different bacteria. It's number one, being prepared before you go with a really healthy gut biome. Taking probiotic in food, kombucha, sauerkraut, kefir, a probiotic that there might be some good data about, just to make sure you've got that good bacteria, but then making sure you've got lots of fiber. Bacteria need insoluble fiber to eat. So it's knowing the fiber in your food, maybe taking a fiber supplement, but making sure you've got a good, healthy gut biome before you go. And then however you can maintain that while you're gone. And when you're back home, to get right back on stuff again, to get your gut biome back in order. The more diverse your gut biome is, the better you'll do. And so it's just to really think about that as you can.
Yeah. And the opposite end of the spectrum then would be constipation, a really common problem when people are traveling. Your colon really has, like we always say, like the seat to your soul is in your colon. If you're feeling uncomfortable, right, you're not in your own bathroom and you're doing just sort of different things, a lot of times your whole tummy can kind of tighten up and really make it harder to poop. again, just as Dr. B said, really thinking about fiber, maybe even taking some fiber supplements if you're not getting in the vegetables that you normally do, and really staying hydrated. Your colon needs water to be able to sort of create a looser bowel movement. Otherwise, it'll just keep pulling that water from the stool, making it even harder sort of to poop. So kind of help your colon out and make it happen.
Yeah. And I just think about, let's say that again, you're not wanting to go to the bathroom and, that water's just getting pulled out. A way to keep the water in your gut is to have some Miralax on hand. So even to take a fiber supplement at night, in the morning, take maybe a capful of Miralax with a lot of water. And Miralax, I think about like little bits of sponge. It stays in your gut and it pulls water from your system into your poo. And so it makes it so you don't get these cement bricks along in your gut. So it's just so important that you keep the Miralax on hand, drink lots of water, and all the other tips. And Barb, love that you're preparing in advance. Yes. I'm so excited you're getting to go to South Africa. I'm so happy for you. I know this has been a big deal. So we can talk more, but yeah, we want you to be prepared.
Yeah. And then, sometimes it can be also helpful to have some Zofran on hand. Zofran's a medication that helps prevent nausea. Again, if you're eating kind of different things and not feeling well, nausea is the worst. So even having a couple tabs of Zofran can really just kind of help you get over that hump. And we're happy to provide that for you if you need some.
Exactly. It's all about being prepared. Yeah. So the next thing we want to talk about is preventing UTIs. UTIs are just, unfortunately, so common, especially if you're in late perimenopause or early menopause and you haven't been regular with estrogen, or you've chosen not to take it, or you can't take it for some reason. When the vagina has low estrogen, it's more basic. The healthy bacteria in the vagina like to have an acidic environment. So, number one is keeping your vagina acidic. And if it's not with estrogen, it's with a product called Good Clean Love. Again, we want all those good bacteria down there in the vagina, around the bladder. And so it's having that very healthy environment. Again, Good Clean Love is a aloe vera based all natural product that acidifies the vagina. And the dose is to just squirt up a little of the moisturizer up in the vagina, spread it around like you're spreading jam, to put that in twice a week and have your vagina nice and acidic. Because again, if you're traveling, you might have a loose BM in the bathroom of the airport. You're wiping as best you can. But still there's extra bacteria down there. And if they get in the vagina, then they can go forward and get into the bladder. Let's say that you have a loose BM and then later that day, the next day you have intercourse. If you have intercourse with a man, the semen has a pH of 7 to 8. And so it's more likely to make those naughty bacteria happy. There's more bacteria down there that might cause a bladder infection. And boom, now you've got a bladder infection and you're in South Africa, right? So number one, we want to help you prevent that. But number two, make sure you've got an antibiotic with you that you can take in case you get a UTI.
Yeah, particularly if you're pretty prone to UTIs. And, believe it or not, women actually are really good at diagnosing their own UTIs based off of symptoms. So, we're always here to help guide women on what that would feel like and having that conversation. But women are pretty good at sort of figuring that out on their own, even without like a urinalysis that we sometimes have patients get. Exactly. Everyone tends to have different antibiotics that work for them. So that is a really good conversation to have with your provider, just to look at past urine cultures if you're someone who has frequent UTIs, just to make sure we're getting you the right one.
Exactly. And, to know potential side effects, to know if a bacteria changes your urine color so you're not worried. Yeah. But again, not only it's avoiding the discomfort of a UTI, but it's to avoid the risk of getting a kidney infection. A kidney infection can be very serious. It's actually, infection of your organ, of your kidney, and it can cause fever, severe back pain, and potentially even sepsis where the bacteria get into your bloodstream. So super important to prevent that UTI, to not blow it off, to not say, oh, I'll just treat it tomorrow, I'll deal with it. So super important, again, to stay hydrated, lots of good bacteria down there, have your biome healthy, and then have the antibiotic with you.
Okay. And then just kind of in that leading in the same sort of field, was there anything else we should do to kind of keep our vagina sort of tip-top shape with traveling?
Well, again, I think it's having a product like Good Clean Love as an acidifying moisturizer. Again, if you're taking vaginal estrogen, make sure you've got it packed so you keep that estrogen level good in the vagina so that doesn't fall off. If you're taking Imvexy or another product, make sure you've got that packed and ready to go.
That's it.
I think that's it.
Okay. Real quick thought, any recommendations about wet bathing suits, right? A lot of us are in and out of the water and sort of in terms of keeping our vaginas nice and healthy.
So again, it's to your point, it's number one, keeping good, healthy bacteria down there, but that yeast infection, also that can happen if you're prone to that. If you have diabetes and high blood sugar, you might be more prone to a yeast infection. It's getting out of that wetsuit as soon as you can. Yeast like it warm and wet. Mm-hmm. And so having all that together, especially if you also have higher blood sugars, and then that's just a setup for a yeast infection. A yeast infection isn't always associated with discharge, as some people think. It can be just really itchy, irritated skin on the vulva. Again, that could be just an irritated skin, but if it's really itchy, and especially if it looks a bit like a diaper rash, like red little spots or just little spots on the outside, or it's bright red irritated, again, it could be something that you would want to treat either with an over-the-counter cream. Sometimes they can be really irritating because those over-the-counter yeast creams have alcohol in them and it can irritate. So sometimes then also having access to diflucan, which is the oral anti-yeast medication. So it's being, really prepared. And so.
Yeah. Okay, great.
Good tip.
One of the other things that we want people to think about is whether or not they're going to be at higher risk for a blood clot while traveling. So our blood really likes to just keep moving through our body. When it doesn't move, it clots. And or if it's given a different prompt. So if genetically you are at higher risk for blood clots because your blood's just a little bit sticky, and then we have you on an airplane for 8 hours, meaning your legs are kind of just hanging out without moving, then you can be at high risk for developing a blood clot in the big veins in your legs, which those are not as important, but what we really care about is those big clots will break off and go into your heart and then block up the heart and lung vasculature. And that's how people die from something called a pulmonary embolism. So that being said, we don't want blood clots anywhere. We really want patients before they are going on any sort of long travel, whether it be in a car, on an airplane, thinking about their risk of blood clots and whether or not if they've had a blood clot before for any reason, or maybe have had a genetic predisposition that they've learned about from their family, thinking about whether or not they should take a blood thinner before going on a long trip.
Right. So too, I think about varicose veins. If varicose veins is something that you have and you deal with, they do pose a slightly increased risk of blood clots. So making sure you've got compression stockings before you go to stay on the plane, so you keep blood from pooling in those vessels down deep in your leg. But also, even if the person next to you is sleeping, you need to get up and walk. So it's just what it is. If you are not on an aisle, if you're on an aisle seat, you just have to expect you're going to get woken up. So get up, walk the aisles, go to the bathroom, and just constantly be stretching your feet, moving your ankles, just keeping your legs in motion. And again, to be hydrated is so important, so your blood doesn't get sticky just from being dry. Another risk factor to think about is if you're on a birth control pill. A birth control pill is oral synthetic estrogen. Oral synthetic estrogen can make your blood stickier. So if you're on a birth control pill, even if you've not had a clot, it doesn't hurt to think about taking a baby aspirin every day. Baby aspirin being that 81 milligram, just tiny little baby aspirin. Celia, unless there's change recommendations for 325, but it's taking that aspirin every day. And it's so important to take it at the same time every day. As I remember learning, the half-life is pretty short. So it's important to take it at 24 hours, pretty much on the clock when you're traveling. But again, if you're going to fly and you're going to go skiing, it's kind of nice that there's a short half-life. We don't want you taking a blood thinner and then you go skiing, heaven forbid you conk your head and have a bleed. So it's balancing the risks of a blood clot and bleeding.
Yeah. And Deb asks, is a baby aspirin considered a good blood thinner for travel? And the answer to that is it depends. So if you've had a prior blood clot, it probably would not be sufficient enough to sort of prevent sort of further blood clots. And you may want to talk to your provider about using something a little bit more aggressive in terms of a blood thinner. If you're someone who's just a little bit worried about having a blood clot just because you know you'll be sitting for a long time, but are considered to be average risk, that probably would be sufficient enough to prevent a DVT.
Yeah. And, we've worked a lot with Dr. Laura Kelsey at Vein Solutions. And if you've had a history or there's a risk and we all just have questions about it that we can't answer, then we'd be happy to refer you over to Dr. Kelsey and she can help you out.
And real quick, just to talk about what does a DVT feel and look like? So, because it can be a little confusing because in general, a lot of the times when we're traveling, we can get some of the similar symptoms. So a DVT usually is what we call unilateral, meaning on just one leg swelling. And it is described as having calf tightness, meaning when you move your calf around, it just feels tight and a little sore. And the leg can seem like redder than the other and just really full. Versus if you have swelling in both legs, that's unlikely that you have DVTs in both of your legs. And that's maybe a little bit more common with traveling, with swelling with traveling. And particularly if it gets better, 24 hours after traveling, it's very unlikely to be a DVT. Right. Versus if the swelling progresses despite being off of an airplane, I would seek out sort of medical attention.
Right. And think about like what a deep venous thrombosis, what a blood clot is. You think about it like putting a rubber band on your finger. You've got blood going into the end of the finger with an artery, but the vein can't empty out the finger. So just like that, a clot would happen in the leg. So there's still blood going in the leg, but it can't empty out. So if you think about a rubber band on your finger kind of starts to turn blue. The same would happen with your leg. I'll never forget, I took care of a woman who was pregnant, which is a very high risk for blood clots. So again, if you're pregnant, also make sure you know your risks and talk to your doctor. But she came in thinking, her leg hurt and it was a little swollen. And I had her stand up and one leg went blue and the other was normal. Obviously, she had a blood clot. We sent her straight to the hospital and we took good care of her. But it's just the color usually is one of the number one signs.
Yeah. All right. So we're going to move on to our 5 take-home tips.
So number 1, be prepared. Like, again, we want you to have fun. We don't want you to be far away and be stuck with something that could have been prevented. So be prepared.
Be prepared, educate yourself on where you're going and any other extra things that you may need, such as extra medications or vaccines beyond your normal, and have a good conversation with your provider about if you need, if you're wanting other medicines for preventing traveler's diarrhea or treating traveler's diarrhea or treating a UTI or yeast infection.
Amen.
All right. Number 2, use food as a tool for limiting weight gain. So we didn't really touch on this too much, but you definitely still need to think about kind of healthy eating, even though you're traveling. That does not mean that you don't eat anything at all and sort of sadly sit there while everyone's having gelato. Absolutely not, right? Food and traveling go hand in hand. It's one of the best parts about traveling. However, fuel your body with appropriate foods before you go out on your day. Really think about getting a good dose of protein and a good hefty dose of vegetables and fiber to really keep your body satiated so that when you're out and about, you are not starving and you're able to make some sort of good food choices. Again, that does not mean not having anything that you want, but having on board that biochemical response from those healthy foods, such as protein and fiber, really sets you up for the rest of the day to sort of make good, sort of self-controlled choices.
I love that advice. I mean, you've told me that, like, if you're traveling, choose protein first. I remember one time you were traveling with the kids and you guys were all starving. Would you guys have like a sub or something? And
oh my gosh,
it was crazy. And you were like, I'm never doing that again.
Yeah, I think we were stuck on the tarmac for 3 hours. That was after like a 3-hour trip and with kids and screaming and I just like inhaled a sub and I just was like, my blood sugar just shot up. I was like, what am I doing? Right. But it happens to the best of us. So.
It does. But to your point, like to make sure that we've got that protein and fiber.
I think something that can be really helpful is taking some protein supplements with you. I always will tell patients this, and I'll get a big eye roll, like, please, Dr. Egan, I don't want to have a protein shake on vacation. I'm like, yeah, I don't want you to have a protein shake either. But if all your choices, you're at a business meeting and all the choices are just donuts, have a protein shake first, right? So that you're just not only filling up and controlling your hunger with those like simple carbohydrates and with limited fiber and limited protein.
Yeah. Or two, if you get on the plane and you haven't eaten anything and you're starving and all they have is white bread and cookies and, the biscotti and, it's just, yeah. So I always carry a protein shake with me in my little shaker bottle. And I think we're going to say that at some point, but to take a water bottle, it's so important to have a water bottle. I have one that's wider when I travel, so I can put my protein shake in it with a little shaker ball and shake it up and I'm good. So it's just to make sure we're, again, preparing, and so we're not disappointed.
All right. Number 3, take your Seeds ebook with you. In so many capacities, you can do this. You can download it on your phone. You can print it out and sort of have even a 1-pager. We have bookmarks that you can just pop it in your book as a gentle reminder of some of the things that you have to do.
Yeah, I mean, we came up with this years ago because it was a list of the 7 basic things that we all need. And I have this in my brain. I think about it all the time, especially even if I have a hot flash or I'm a little stressed. I go back to, okay, did I have my water? Am I rested?
Mm-hmm.
Did I do my metered breathing? Did I take my vitamin? Do I have my healthy carbs, healthy protein, healthy fats? Like, again, even if I'm going to travel and I can't work out, am I going to do my stretching? So again, it's just a reminder of those 7 basics. It's helpful to have them right in front of you.
Yeah, particularly if, I always, in my sphere, we sort of think about cravings, right? I always say cravings are a manifestation of your day. If you're not sleeping, too much alcohol, not stretching, not getting the right foods, you're going to have really high cravings, and that itself feels uncomfortable. So I love it, even as our bookmark, just a quick rundown of the different things that you should be doing. Exactly. All right, number 4, bring your water bottle. We talked about this.
Hydrated,
to prevent constipation, to prevent ulcerations, right? All these different things, hot flashes.
Yeah. So and remember, it's net water. It's how much water minus caffeine minus alcohol. So if we want to have at least 80 net ounces a day. I mean, we could argue all day if it's 90 or 70. It's knowing what's right for you, but it's thinking about that net. So today I think I'm a little behind. I've had a little more coffee today, not enough water. So I got to catch up when we get off tonight, but it's just making sure we think about that balance.
Yeah. And martinis don't count.
They do not count. Okay. Nor does coffee.
Yeah. All right. Don't be shy about taking some extra stuff, some extra underwear, extra wipes. We talk to women from a lot of different age groups, from a lot of different places. This is a common problem, right? That affects all of us. So don't be ashamed. Pack some of this, get ready. It's, nothing's worse than having to worry about it on the fly and not being ready. So just kind of pack the stuff, and maybe if you pack, you don't need it.
Exactly. Or having to take off your unders in the plane bathroom and throw them away and put your pants back on. So just take some extra unders in your little bag as you go off to the plane bathroom.
Yeah. And wipes. I mean, the cheap toilet paper is terrible.
Exactly.
Okay. All right. So for all of those folks who are not in the state of Michigan or Florida or some of the other states that we're in, thinking about some questions to talk to your primary care doctor about. So our 5 questions: what vaccines do I need for my trip? We'd hope that your provider would be able to sort of review some of these with you. A lot of them are country specific, and you can do your part by going to the cdc.gov to figure out what country you're going to and really reflecting on whether or not you're going to be traveling in rural areas to help make a choice about vaccines.
Right. And some might need to be ordered by your provider versus things that you can just get at the health department. So it's important to ask that question.
Number 2, what extra medicines do I need? Right? We hope that, we're in a world now where, in general, we've really brought down the amount of antibiotics that we're giving out, which for good reason, right? We should not be giving antibiotics out like candy, 100% not. But at the same time, if you're going to a place where you're not going to have access to those things, it can be helpful just to have some as needed, just in case. And of course, you can always dispose of them back at the pharmacy when you come back if you did not need them, so that you don't feel like you have them sort of floating around. But thinking about extra medications for traveler's diarrhea, a UTI, even maybe a URI, if you're out and about, sort of being exposed in airports to a lot of different respiratory viruses can be really important.
Yeah, especially if you have a history of asthma or frequent infections or any lung disease, to make sure you've got that medication in case you get that upper respiratory.
Okay. And number 3, am I at higher risk for a blood clot during my plane ride? This is a great, I honestly think most people should have this conversation with their provider and understanding where they stand in terms of having a blood clot, and then talking about what you should do to sort of prevent those blood clots in the future.
Exactly. Yes. Have that conversation.
Do not forget to move your body when you're in a car or on a plane. Even just flexing your calves back and forth can really swish that blood around to sort of help prevent blood clots.
Agree. Number 4, how do I prevent UTIs during my trip? So again, talk to your doctor about this, your provider, about your risk factors for UTI, making sure you're prepared, making sure you've got what you need with you. This has to be personalized and look at what your risk factors are in particular. So please ask this question.
And Dr. B, you're going to love what I'm going to say next, because we didn't add this question that we normally ask, which is, what is my phase of ovarian function, right? Wow. If you're in the time period where you're perimenopause, you're starting to have those beginning symptoms of menopause, your menstrual cycles are going a little bit wonky, your estrogen in your vaginal canal is also changing. So you need to know where you're at in terms of your phase of ovarian function to think about the next steps moving forward.
I love that you asked that.
There we go. Right. All right. Number 5. How do I prevent weight gain during my travels? Right. Have a plan about this, right? The worst thing we're all working hard to stay healthy, to be healthy on our day to day. Right. And even though food and is an important part of travel, have a little bit of a plan that, we're not gaining the 20 or 30 pounds during our trip. Because that really, no one really wants that. And you still can have a fun time and enjoy all the foods that come with traveling if you have a bit of a plan. Sticking to your seeds, thinking about water, fiber, protein, being mindful of what you're eating can really be helpful.
2 things. I think, first of all, being mindful. I was thinking about a patient recently went on a cruise, and of course there's all the food all the time. And so it's just sometimes hard. The food is so beautiful and it's colorful and it tastes so good. And, but then, the regret was like, oh my gosh, I gained so much weight. Now I'm gonna have to work so much harder. And especially if your phase of ovarian function is early menopause, which can be a state of insulin resistance and prediabetes, it's really hard. But to ask your provider, what is my risk for gaining weight? I have PCO. What is my risk? How can I prepare? I have menopause. Like, really make sure you understand to know what is your A1C, what is your blood sugar before you go. Like, again, know what your risk factors are and what you might especially need to try to avoid or limit.
And remember, when you're traveling, there are 9 different types of hunger. There's eye hunger, there's nose hunger, there's ear hunger, there's heart hunger, right? And sometimes we're going to be triggered into eating when maybe we don't necessarily need a ton of it, right? Like, if you see something so beautiful, like, you may just be triggered from looking at like a beautiful dessert, and maybe 1 or 2 bites is enough to sort of say, look, I enjoyed this beautiful aspect of a dessert, and you can move on, versus not truly paying attention to those things. And then all of a sudden, right, we're down 3 or 4 desserts when our body wasn't even really asking for that.
Right. And the first bite is always the best.
The first bite, the first drink, the first sip is always the best. That's right. And I think that applies to alcohol too, right? I don't know how many times traveling, right, we have that kind of extra glass of wine that we probably didn't need. Okay. Well, I know someone who's traveling very soon.
I am.
And that would be you. Yes.
So exciting. And I certainly don't want to be sick in Italy for my wedding. So yes, I definitely I will take all this in mind, and I'll be prepared. So, and also don't want to gain a lot of weight while I'm off in Italy. So it'll be being prepared. So I appreciate all these tips myself as well.
Yeah. So Sue gave us a huge discussion. Thank you, Sue, for sharing so much stuff. I like the part about, having your husband
sex toys.
Yes.
Thank you for sharing this.
You can always come and talk to us. Any patient of ours, we love talking about sex toys, and we have them in our office that you definitely, if you're too shy to find them online or at a store, right, that can feel a little kind of silly, come to our office and we can show you. You can hold them and, kind of fumble around with it and pick out the right one for you. So we are always excited to talk about that and help support women's sex life at home and away.
Yes. All right. Thanks. You appreciate that. Thanks, everyone. Travel safe.
Yep. Thanks. Bye.